Ovarian cysts. Females have two ovaries. Ovaries are about the size and shape of an almond. There is one ovary located at each side of the fallopian tubes. In the ovaries, eggs develop and mature, and are then released in monthly cycles during childbearing years. Ovarian cysts are a common occurrence. Cysts in the ovaries are harmless sacs that are usually filled with fluid in an ovary or on its surface. Most of the time, there is no pain or discomfort and can usually go away with treatment. Most ovarian cysts are a result of menstrual cycles. These are called functional cysts. Functional cysts are small cysts that grow in the ovaries called follicles each month. These follicles produce a hormone called estrogen and progesterone. They break open to release an egg during ovulation. A monthly follicle that keeps growing is called a functional cyst, and there are two types: follicular cyst and corpus luteum cyst. A follicle cyst is when the follicle does not rupture and release its egg halfway through the cycle. Instead, the egg continues to grow and forms a cyst. A corpus luteum cyst is when the opening where the egg is released becomes blocked. Fluid builds up inside the corpus luteum, causing a cyst. Functional cysts are harmless and does not normally cause pain. They also disappear on their own, but there are less common cysts. A dermoid cyst is a cyst that forms from reproductive cells that make the eggs in the ovaries. This type of cyst is usually non-cancerous and can contain tissues such as hair, skin, or teeth. Another rare cyst is a cristadenoma. This type of cyst develops from cells that are on the surface of the ovaries. The cyst can be filled with a watery or mucus material and can grow very large. The last of the rare cysts is endometrioma. In endometrioma, cells that form endometriosis attach to the ovary and form a cyst. A dermoid cyst and cystadenoma can become large and can move the ovaries out of position, causing increased chance of twisting, called ovarian torsion. Ovarian torsion can be painful and reduces or stops blood flow to the ovaries. One symptom of a large cyst is pelvic pain that does not go away. The pain is often a dull ache or a sharp pain in the lower abdomen, below the belly button. Another symptom is feeling fullness, pressure, or heaviness to the abdomen, and finally feeling bloated. A doctor should be seen if any of these symptoms occur, as well as fever, vomiting with pain, having cold, clammy skin, rapid breathing, and lightheadedness or weakness, as it can be signs of shock. Women with hormone problems, or those that take fertility drugs that causes ovulation, such as clomiphene or letrozole, are at higher risk for ovarian cysts. There are also times when pregnancy increases the chances of ovarian cysts. This is because the follicle that forms in ovulation stays on the ovaries throughout the pregnancy and can sometimes grow larger. Those with endometriosis, as noted above, are also at higher risk for having ovarian cysts, as well as those with severe pelvic infections, as it can spread to the ovaries. Women who have a history of having ovarian cysts are likely to develop more. Complications from having an ovarian cyst does not occur often. One of the complications noted above, ovarian torsion. Symptoms of ovarian torsion includes pain to the pelvic region, as well as nausea and vomiting. Another complication is when a cyst ruptures. This can cause severe pain and bleeding inside the pelvis. Often a large cyst has a greater chance of rupture. Rigorous activities in the pelvic increases risk of rupture, such as vaginal sex. A cyst on the ovary can be found during pelvic exams or imaging tests, such as pelvic ultrasound. Testing depends on the size of the cyst and whether it is filled with fluid or if it is solid. Your healthcare provider will determine the type and will recommend the needed treatment Examples of tests include pregnancy tests, pelvic ultrasound, laparoscopy, and tumor marker testing. A positive pregnancy test may suggest a corpus luteum cyst. In a pelvic ultrasound, imaging is used to confirm a cyst, its location, and whether it is filled with solid or fluid. Tumor marker testing is done to determine if the cyst appears solid. Solid cysts are at higher risk for ovarian cancer. Solid ovarian cysts that develop after menopause can be cancerous. Treatment depends on the individual's age, symptoms, and size of the cyst. Many times, your healthcare provider may just monitor the cyst. This is typical if there is no symptoms or an ultrasound shows small fluid-filled cyst. Hormonal contraceptives such as birth control pills can prevent ovulation, which can prevent more ovarian cysts. Birth control will not shrink any existing cyst. If a cyst is large and painful and does not look like a functional cyst, your healthcare provider may suggest surgical removal of the cyst. Some cysts can be removed without removing the ovaries, but in some cases, the ovary may be removed. Removal is done by laparoscopy. While there is no prevention for most ovarian cysts, having a regular pelvic exam ensures that any changes to the ovaries are detected as early as possible. Females should be aware of changes to their menstrual cycle and unusual menstrual symptoms, even if it will go away after a few cycles. Thank you.